Hey everybody, Dr. Dennis with Olson Brothers Chiropractic. One of my major pet peeves is when some of our practice members come in and they get their spine to a super good level and then they feel like the work is done and they don't have to do anything anymore. And that feeling of being at the finish line, it's great to finish that goal and celebrate that. But one of my great friends, and he's not even a chiropractor, and I had a conversation about this, and it really is baffling to me that people don't think about their health in more of a big picture, long term way. And so when a patient finishes their plan, whether it's a corrective plan or a relief care plan, the thought that they're good moving forward is always baffling to me. There isn't anything in our life that, if we don't show it attention, will wither and die. Okay, and you can use the simplest examples. If your grass doesn't get water, it's going to wither and die. If you don't put water that tree, it's going to wither and die. If you don't give energy into your relationships, they'll wither and die as well. And so when it comes to our bodies, we throw that out the window. Our bodies are an incredible piece of engineering, and yes, it can take a horrendous amount of abuse, but at some point you hit that tipping point where now all the crap that you eat and all the lack of sleep and the lack of water and the sugar that you're eating and everything else is going to start to mount up, and it catches up with you. Now, some people that starts when they're 30, some people when they're 40, others have this genetic gift where they can eat and smoke and do everything else, and they don't have those chronic problems, but at some point it's going to get to them as well. So when people have the question, how long do I go to the chiropractor? I always answer that same question with, how long do you want your spine to stay healthy? Because when we look at our spine and what it actually is doing, it provides framework for muscle attachments and structure for our body to be upright, obviously. But if you can see on this model, two vertebral bones, the discs in here, what it's protecting is your nervous system, the spinal cord, and all of these spinal nerves that go out to your organs, whether it's GI system, kidneys, liver, reproductive organs, heart, lungs, the glands and structure of our face. So when we have an area that starts to wither and starts to deteriorate, you can see the difference between these two. Which one would you rather be? Okay, then this nerve is supposed to carry all that information from the brain to your kidneys. Absolutely won't do that. It's not going to do that. It's just like if you were you had a brand new hose shooting water out to the lawn just fine, and then you took this old hose full of holes and cracks and stuff and turned it on. Well, about 10% is going to get to the tree. The other one's going to leak all over the place. You're not going to get that direct full amount of water to that end area. It's just the same as your nervous system. You're not going to get that end full energy to those organs. Likewise, those organs are not going to be able to communicate back up to our brain the way they would if you had a highly functioning nervous system. So chiropractic is way ahead of its time, guys, and it's going to be proven that way years down the line. This experiment of taking all these medications and things like that, that's gone. And if you're still doing that, I urge you to get healthier and to stop. Get in and get your spine tuned up. If you're having respiratory issues, get your middle back adjusted. That's where there's neurology from the spine goes, where those nerves go to our respiratory centers, bronchial tubes and lungs. If you're having lower back pain, there's a real high risk that your reproductive area and your lower GI tract is being compromised. We want you to be healthy, and it's not that hard. It's not that expensive at all. Get to a baseline. That could take 6 to 8 weeks, and then after that, level out and go once a month, once every 3 weeks. I get my spine checked every week, just like all the rest of our staff does and my family does. Why would I ever recommend less for you? But you can do as much as you want. You get past once a month, it just doesn't make sense. That's not maintaining anything. That's reacting again. So, Dr. Dennis with Olsen Brothers Chiropractic, get in, start living as healthy as you can.